My name is Amol Nirgodkar. I'm the CEO of Patient Prism, and delighted to welcome Dr. AJ Acierno from DecisionOne into our studios this afternoon. And we're talking about his story, the DecisionOne story, from the evolution from one practice to 25 now. And part one of this segment was, how did it all start? The dental school experience, the first two practices. In this segment, we really want to talk about the next journey, the next part of the journey where you went from 2 locations to 5, right? And what happened? How did it go about? Did you acquire practices? What kind of challenges did you face during that period? And then in the third segment, final one, we'll talk about, okay, now you're this dental support organization that's leading 300 people. So let's talk about that. Let's talk about that little middle period where you went from 2 to 5.
Yeah.
And what was it like?
So the first aspect is that you have to figure out what you really want to build, right?
Okay.
What are you trying to do?
Sure.
Especially in today's day and age right now, and 10 years later when we're looking at this, who knows what it's going to be. But
Sure.
Right now the question is, are you building a group to last?
Sure.
Are you building a group with all those foundations that make a great company?
Sure.
Or are you building a group just to kind of sell off and do something?
Okay.
Early on, we committed to building a group that's going to last.
Okay.
And we have an advantage, my brother and I, since we're dentists. We know
Sure.
what we wanted. We know what our colleagues wanted. We know
Sure.
what that was missing.
Okay.
We know what our patients wanted. So that was the first aspect. That was probably the toughest, right, is planning what does that mean?
Okay.
And of course, coming from Heartland, I knew like all the great things that they had,
Sure.
but we don't have that. So
Sure.
what we did basically was this. We took our best people,
Okay.
or our people that wanted to help us outside of our office. So Pasta, my front desk person,
Okay.
who everybody loved and cared for, well, Pasta was going to be somebody that's going to help me at our next office.
Very nice. Okay.
And Cheryl, my dental assistant, she was going to be. So we were able to take those people and not increase support center cost, right?
Okay.
Because we're using them. That
Okay.
was already a cost to us
Okay.
to help us on the outside at these other
From a
practices.
training standpoint.
From a training standpoint,
Okay.
from an implementation, from a support. Hey, we got this problem, we got this.
Okay.
Along with using our systems. Our IT department was not an IT department, it was an
Sure.
outside source that we did.
Sure.
My dad was a CPA / hey, if anything breaks in the place.
Absolutely.
My dad retired from his private practice, and we took him out of retirement and brought him in.
Nice.
So he helped us with those aspects financially. And then we felt like, okay, we're going to go out and buy our first practice. And as we did, again, there's a little bit of luck that comes involved, right?
Okay.
We bought a really great practice.
Sure.
And that was strategic. And one of the other aspects that we made sure was, if this practice failed,
Yeah.
the money that was being generated by both my brother and I's practice
Sure.
would be able to support that failure. We never did a deal that we were like, well, that practice has to make money day one,
Right.
or else we'd be in trouble. And we did that for probably our first 10 practices.
So those first few practices, were they similar to yours?
Yep.
Similar to yours? Were they fee for service mostly?
No, they were. The first practice we did was fee for service. Yes.
Okay.
Yes. Yeah.
Okay.
It was fee for service, and it was my brother's practice was PPO at the time, and mine was fee for service.
Okay.
We didn't buy that practice, not knowing now. We didn't buy it because it was fee for service, because it was PPO.
Anything.
We bought it because it seemed like a great practice.
Okay.
And that dentist was retiring right away, and there was an associate already in place.
That was important because
That
you
was
don't
important.
want to go find an associate.
I didn't have to go find an associate. So
Wonderful.
It happened to be that associate.
Okay.
Rock star, absolute rock star, and so we got lucky in that circumstance.
Wow.
And we got lucky in the fact that the practice had more patients than what we actually expected.
Wow.
Okay, so
Wow.
it was
Wow.
that first one was a lot of luck, but
Okay.
we learned from that luck. We learned, okay, the next practice we buy, we got to make sure that they have these many patients, or else we would have been in trouble.
So active patients.
That's
You looked
correct.
at active patients. You looked at the quality of the dentist. Was he a rock star or not rock star dentist?
Correct.
Had the same philosophy as you guys in terms of practicing?
We
or you
weren't
you
even looking
dictate
at that. No.
None of that
No.
stuff. How about the staff? Or did you evaluate the hygienist, the assistants, and anybody else?
Our evaluation was as much as just hey, great, you look nice and you didn't yell at me, so you're on board, you know?
Wonderful.
We didn't really have any due diligence process. Our due diligence was very simplistic. It's just some of the things that I learned from others in the due diligence process.
Well, what made those first 3 or 4 acquisitions successful? Was it?
So once we got to like 3, 4, and 5, right?
Sure.
What made those successful is this, just straight up. We think about patient flow, patient acceptance. Patient flow, was there a good amount of patients already in the practice, or were we going to have to market the heck out of them in order to get them?
Sure.
That we made sure that they had a lot of patients coming in.
Okay.
Patient acceptance, is the doctor and the team supportive of the doctor in their diagnosis, and are patients actually accepting treatment to get better, right? Those are the 2 deciding factors.
So you looked at people, you looked at processes, but you looked at a lot of internal marketing mechanisms. So are there a lot of patients that are not accepting treatment? And let's work on that first before we start going out there and getting new people to come in.
Absolutely.
So you fixed that first.
We fixed all those. So we look at customer service.
Sure.
Recall, making sure that we can bring more patients into the practice.
Sure.
Treatment acceptance.
Sure.
We wanted to make sure that people were accepting treatment.
Okay.
And accounts receivable, making sure that they can collect money.
And so so you learned, so you basically were trying, these were the foundations of building a DSO that's going to come about.
Those are our foundations.
Foundations.
Yeah.
And then how long did you operate those practices before you said, okay, I think we have some rudimentary systems set up. I mean, we may not have them formalized like Heartland does, but we're still getting there, right?
2 years.
2 years.
2 years of those 5 practices where we really had to formalize a lot of those things.
Right.
And you're learning every single acquisition. Even today, we're still learning every acquisition. And what we wanted to make sure is that when we took these practices over, right, we can better them right away.
Okay.
That we can somehow better them. What we didn't know at the time was they also bettered us.
Nice.
So it's we're learning as much from them as they're learning from us.
And was your approach like, was that approach kind of relate to the team members that, hey guys, we're not these big acquiring people that are going to tell you what to do. You can also tell us what to do, and we're together going to build it better.
Remember, I had my dental assistant next to me and my front desk person, my brother.
Okay.
We're all in it together with them. We're doing the same exact thing they're doing every single day. So it was a great relationship between there. We did know how to run great dental practices. So we had 2, then 3, then 4 really great dental practices. So we can go back and look at everybody and say, just look at these, right? Talk to those people, learn from your colleagues what they're doing. And what we started to notice then is, oh my God, we got to start setting the culture.
You got buy-in from everybody.
There we go. We got to start, what is our culture? What are we buying into? What is the vision of this, And then that started to culminate. Remember, in the beginning, everybody wants to, great is the enemy, right?
Good is the enemy of great. Yeah, you're right.
Good is the enemy of great. So you have to be careful that in the beginning, that you're just setting it up and you're not trying to make it perfect. If we tried to make it perfect, I'd still be at 2 practices right now.
Right, because you got everybody involved in the process and got them together and provided them support and gave them a vision of that, hey, we can do this together. That's what was the most successful. That was the reason why these were successful.
The first 5, it was the vision. It was establishing a vision and encouraging our team members, encouraging these offices to become something better than what they were.
Yeah.
That's what created the first 5 to go really well.
So we'll talk, in the next segment, we'll talk about, okay, now we've built a prototype of a DSO that's going to come about. So after 5, things start getting challenging. And I want to dig deeper into those challenges that you had, because now all of a sudden you've become a slightly larger business. But this is great. The foundations of building the first few locations, the first few practices, you have to build those foundations early on. Otherwise, you can't just go on acquiring practices after practice after practice and not have. Otherwise, it all collapses. And we've seen this happen in the DSO world.
We've seen this happen in a lot of places.
Over and over again. It's not just about the quantity of practices. It's about the type of practices that you acquire, and also can you get the people to buy into your vision, and do they feel part of the success?
That's correct.
So great discussion on this. We'll continue the discussion. Thank you, AJ.
Thank you.
Thank you.
Present.
Thank you.